we're going to look at training, healthcare, and education. Could you all briefly introduce yourselves or reintroduce yourselves and give us a quick overview of who you work for and exactly what your take is on this before we get into the questions? And let's start at that end.
Hi, I am Timothy Jung from I'm a director of a creative AR and VR hub at Manchester University. I think we are doing a number of different projects, including educational projects. Okay?
Great stuff.
Sorry, my microphone's not working, so Hi, I'm Marcus. I'm a part of a startup from Imperial College London called Evanescent Studios. We're looking at education in terms of language learning, how we can use virtual reality to kind of make it more accessible, make it more exciting, that sort of thing.
Hi, I'm Steve Dann. Obviously, I'm co-founder and CEO of Medical Realities, but I also have another company called Amplified Robot, which also works in VR and AR space. We've been in that space now for about 9 years, and we've been passionate about what VR and AR can do for the future. And it's great to see sessions like this and conferences like that we're holding here, which is pushing forward the boundaries of understanding about what can be done. And just one other thing, I actually run an augmenting reality meetup group. If you want to join that, it's all about VR and AR. We have nearly 3,700 members, so please come and join us if you'd like to. Your turn.
Hi, I'm Nicholas Minter-Green from The Economist. I'm the president of Economist Films, which primarily is a 2D content creation business, part of the Economist Group. We just started our VR journey. We've made one 360 video and 2 CG-driven pieces. I suppose I'm here to represent both sort of content creators and media owners in this space.
I'm Tim McGrath, and I've worked in the oil and gas industry for 25 years as a safety professional, as an oil and gas engineer. I was also a senior lecturer of oil and gas engineering in Western Australia at the University of Western Australia. And I founded an organisation called Zero Harm Health, Environment and Safety. And I'm co-founder of a meetup group in San Francisco where we're looking at the non-gaming applications of virtual reality, augmented reality and mixed reality. So I've developed 3 virtual reality immersive simulators where we assess the safety behaviours of oil and gas workers to try and address the scalability problem of not having enough trainers and instructors to train our offshore workforce that are remote and expensive to visit and provide that training assessment. So yeah, that's me.
Yes, hi, I'm Chris Chin. I'm Senior Director of VR Content for HTC Vive. Focused on healthcare and education, we feel very strongly those 2 areas, as well as other non-gaming verticals as well, have a strong potential for transforming how we do things. And so very excited to be here and join the panel.
Excellent. Thanks, chaps. I've got a couple of questions, and then hopefully we'll have some questions from the audience. I'm fascinated by all these different applications, and I think as Steve and I were talking about yesterday, we've also seen sort of things like virtual worlds 10 years ago that was promising some of this, but we now are actually seeing it works and the technology is capable. I think the interesting thing for me, and particularly maybe in the sort of safety space and the medical space, is how we link that training to effectiveness. Nicholas talked about this in terms of learning experiences, but what are you finding are good metrics in terms of, rather than just testing people or asking them if they had a good time with the training, how are you measuring whether it's done its job? Tim, I start with you.
Yeah, so that's my expertise. I've got a degree in education, and so I'm a competency-based instructor as well under the Australian training framework. And so I built my simulator with the total purpose of assessment. And so once people are familiar with how to navigate in the virtual world, they're being assessed. I track everything they look at, every step they make, and everything they interact with. And throughout the scenarios are unsafe situations And if they walk by them without noticing them, that's one thing. If they walk by, notice them, avoid them, that's another thing. If they walk past them, avoid them, stop and sort it out, that means either contacting the control room or sorting it out physically by picking up or, litter, stopping a leak from a barrel of oil that's dripping on the deck. And some people are even above that. So I've discerned a fourth level of person that will actually stop when there's the feeling that something is going to go wrong. And then they'll come back to the control room and say, I think things, this area has a problem. Can you come and investigate it with me? And so being able to assess people within minutes has enabled us to either prescribe further training for some people, to not hire certain people, to not give people a responsibility for a role until they've acquired the skills necessary to demonstrate they can do that role. And it's also stopped people from having to attend further training. So we've saved money, or we've given them more specialized training that they were ready for. So it really is economizing on physical training, which means hotels, flights, and course attendance fees, and time off the job and backfill replacement of those staff. So we are actually showing an economic improvement of 40% by running these assessment systems. And also, we think we're reducing the number of incidents occurring because we're sort of catching people that might lead to an incident, and we're giving them the just-in-time training so that they can recognize that hazard and address it.
That's that's very advanced in terms of metrics, and I get the feeling that certainly from what you were saying, Steve, we're sort of really at the start with the medical training. Yeah. Any other thoughts in terms of sort of educational outcomes, how we can measure that? Anybody who'd like to chip in?
Well, we're quite lucky because Shafi is a training surgeon. He has 200 students under his wing already. So they are our guinea pigs, and very willing guinea pigs, and they're really excited about VR and new technology. And we're getting a lot of great feedback, especially from them, which is helping us change what we're doing and how we're doing it. So it's great to have that amount of people that are actually giving us direct feedback.
I think just to add on to what Tim and Steve are saying, so the data is key, right? Never before have we had ways to assess instantaneously how people are learning. And so not only can you do follow-up training, you can actually do adaptive real-time learning, and I think that's kind of what you're getting at. For kids in school, kids all learn at different rates. They all learn differently. When you have an adaptive learning system as intelligent as you can get in a VR system, I think the sky's the limit in terms of how they'll engage with the content, how the content's surfaced to them, and how different ways of actually interacting with how you actually are learning.
Sorry, just one other thing I was going to add on to. Of course, by being in VR, we can actually then use that system to actually get more information back. So we can constantly monitor how people are using our VR training tools, and that's going to give us a lot of answers as to how we should progress in the future. Excellent.
So the other question I had was something that was sort of raised earlier on by a presenter around sort of content capture. And Nicholas touched on this as well. This idea of, it's not like film. You can't guarantee somebody's looking in the right place. They have to be directed. So I think particularly in this area of training, simulation in some of the safety cases, how do you learn a new language of capturing this content so that it makes sense to the viewer and you are getting those positive outcomes? Thoughts at the end, Dr. Tim?
Actually, one of the projects we just started at our university is using virtual reality for training health workers. The traditional curriculum has about 50 different scenarios in terms of training health workers. The context is that patients were discharged from the hospital, okay, and after 2 weeks, social workers or psychologists, they should visit, patient, okay, and then there are a number of different levels of training, and one of them is I think they should. In our curriculum in the health faculty, they are using 50 different scenarios. So, in order to especially in order to have that kind of simulation scenarios, it costs too much, okay, and too many different scenarios. So, we actually started some let's try first scenario. Of course, there are lots of different level of contents, different situation, and it's much more complicated in the later stage. However, let's try first scenario, and within the scenario, there are lots of stimuli and interactions, and that is that can be developed, and it can be used for students before they come to class. Right. And also, after their simulation class, they can actually still be there again, right? So I think we are actually one of the kind of university working on that particular area at the moment.
Right,
yeah.
Right, interesting.
I was going to say, I mean, it's such a broad area. It really is going to be very different depending on what you're trying to get out of what kind of student, what kind of outcome. I talked a bit about sort of narrative documentary. I mean, in a historical setting, it could be a very on-rails experience where you are taken on a journey, told a story, using narrative filmmaking skills to bring to life in a very sort of immersive way a sense of history or a sense of moment and time. That's very different to a very practical outcome where you need to know safety protocols, how to fly an airplane, where actually interactivity levels have to be very high, creating a completely different production process, and also then obviously a completely different delivery process. And a challenge that we have is because it is also different, there's no sort of standardized way to deliver this stuff through the headset experience or the infrastructure in classrooms. So, yeah. Quite sorry, it is it's a big old feat.
That's one of the challenges because, and then what kind of contents or function you will have in the virtual reality? This is a big question because there are not many use cases. So our approach was, okay, instead of creating completely new from the scratch, how about, there are 50 different scenarios, take one of them, let's try whether it's working or not. And virtual reality application is not complementary kind of add-on to the existing training program rather than completely replacing the learning experience. So we'll see whether it's working or not, but clearly we look at the different scenarios and take one of them, and then all the contents and functions will be developed based on the different kind of scenarios. So that's something we are trying to do, and hopefully can be applied in the kind of wider kind of a health education training, like with NHS.
Tim?
Yeah, I've got a take on it. Sort of I think that the learner really knows what they want to learn. So if you have provided a set of curriculum, and there's actual steps of competencies that need to be acquired, they can choose the environment in which they learn them. So if maybe in the oil and gas industry, if they work onshore in a gas treatment plant that's surrounded by fields, and it's a very large acreage with storage tanks and stuff like that, they can choose that environment to have these lessons taught to them. If they work in an offshore exploration environment with a drilling rig, then they can choose that environment. And so you've got multiple layers and a floating structure that's always moving. If they're in a production platform, they can choose that infrastructure, and you've got a lot of noise, a lot of process equipment, and so that's what I've been trying to convince the industry to do, is to go with generic types of facility where they can, and let the users decide. Some of the customers have actually said, what we want is the actual facility that they're going to be working on. We'll give you the full CAD model, and we've had to decontextualize that so it'll run in the model, so that the people can be trained in the environment in which they will be working in maybe sort of 6 months to 3 years' time. So there's lots of ways of doing it.
Marcus?
Yeah, I think we can learn a lot about potential solutions to this problem by drawing a parallel with game and level design. Because there are lots of different types of like ways you can get VR content out, and I think it really depends on the end goal. It's going to vary from product to product, right? So in our firm, for example, we were thinking about, how are we able to teach history through virtual reality content? And I think maybe in that kind of context, a more linear rather than open-ended platform would be better. For example, we can catapult the students all the way back to 1790s revolutionary France, and then we can give them a scenario where they can learn about the aristocracy and the point of view, and then we can move on to the next one to force them to, look at from the point of view of the townsfolk and so on. So it's linear in that sense, and we can definitely guide that in a way. It just depends on what content you're using. If you're trying to train workers, it's going to be different.
Yeah, I think what you're hearing here is every use case is different, right? Simulation, using alternatives to current training, complementing training, basically kind of more linear storytelling, if you will, and emergent experiences. So I think the paradigms that's what makes it exciting. It's wide open right now. There isn't anything that's fully established. All these things are actually getting researched and proven out. But I can just imagine, my son, he's trying to learn the phases of the moon. Well, if he were actually in a 3D space in virtual reality, he could do that with his hands. And he might learn that better than getting that from an iPad or from a textbook for sure. But just being able to kind of experiment and having play-based type ways of learning, that's another way, kind of to your gamification and game design point. So there's lots of different ways. Again, it's use case contextually based.
I think that's absolutely true, and I think that idea of, to your point, Nicholas, and also what you were saying, Steve, that idea that this is never going to be the end point of training. You're not going to put somebody into a pair of cardboard goggles and then let them loose on a patient. You're not going to put them just through the VR simulation, but this gets you a lot closer to maybe in-person training. A lot cheaper than any other method before, and that gets better and better as you move to interactive environments and things like that. And same with education. Ideally the combination is with a teacher, not to replace a teacher.
But there's also reasons, beyond that there's just no other way to experience it. So there's for things of extreme danger or things that don't exist anymore, like those artifacts in northern Iraq. Without the virtual experience, there is no experience. So, sometimes, it is a matter of how it's delivered and the structure around it. But what's exciting, gives us, I guess, courage with all of this, is that for a lot of things, it might be the only way to experience it.
That's a good point. That's a good point.
I think also there's an aspect to training, especially because there's the technical aspect and also there's a wider aspect. And training surgery actually makes us challenge both those things, because there's the technical aspect of the surgeon actually doing the surgery, but in actual fact the surgeon doesn't operate alone. He's surrounded by other people in the room, which in actual fact makes it great for virtual reality, because it actually puts you in there with them. It also enables you to interact with other people, whether the other doctors, other nurses, the anaesthetists within the room. So not only is he dealing with the actual sort of technical aspect of doing the actual operation, but he's actually having to run his team as well. And that's sort of crossing the barrier from just the technical side to the empathy side as well, where you've got to interact with other people. And I think being in virtual reality, that's really proved very helpful.
Particularly that's interesting compared to those surgery devices where you are basically just in the classroom with the surgery device.
Exactly.
Final question from me, and I'm not going to put you on the spot, Chris, but we were talking about access to headsets, and Chris and HDC currently sit at pretty much the top of the pile in terms of consumer available headsets, and then we go right the way down to the cardboard type devices. How do we make sure that that if you are looking for that deep training experience that requires interaction, that requires the sort of the gaming run through, versus maybe just the 360 video, how do we ensure that in education in particular we don't create yet another sort of two-tier system? I'm going to put you on the spot, Chris.
No, it's a fair question. Just have at it.
Bring it on.
Pile it on.
And I don't have the right answer. I mean, what it is it's all about the technology evolving. I think we all agree. One of the earlier panels was about AR and VR and how we agreed it was all merging together into one solution. Look, this is 0.1 of VR, even though it's kind of the third wave, if you will, because it's been tried 2 times before in the last few decades. But we're just 6 months into it, at least from the Vive standpoint. We've already seen kind of cuts in price and cuts in requirements for PCs. HP announced a laptop that works with the Vive for $700. So now it's $1,500 for a combined system, which is actually a lot less than it was 6 months ago. So if you follow Moore's law, I think by default you'll see that those price points come down. But by the same token, I think there are other solutions out there. It may not be, you might not need the full immersive room scale 15 foot by 15 foot system for every kid in the classroom. In fact, you don't have the space for it, right? So, cardboard is a very popular method of choice, and I think Daydream is now kind of priced lower than Gear, $79. We're also providing a phone that's compatible for Daydream, so we're a partner with Google on that front. We really want to get that out there for everyone, and I think, just seeing what's happening the last 6 months, the last couple of years, we're going to get there. It's just a matter of time.
I'm just looking at the accessibility point of view. It depends on the price. I mean, because not everybody can afford like £1,000 or £2,000. But there are different types of VR kind of headsets available in the market. Okay, but I think I'm looking from the learner's point of view that while they're at home. Okay, and where they are in the education side, either university or college or actual. It can be cultural learning side. It can be museum. Can be learning side. And after that, when they came back home, so probably kind of a low price that is accessible for everywhere. So that is quite useful for the accessibility for everybody. Yeah. But when it comes to really immerse, that will give you kind of initial kind of experience, and then they will get interested, motivated to come to learn a bit more. Then probably HTC Vive, which is top kind of price, really, it feels like a real, okay? That can be much more powerful, okay? But not many people will try that HTC Vive until they have an experience, okay? So therefore, I think we need to develop a different strategy in terms of cost and accessibility.
Yeah. I think maybe it gets this idea that I was pimping out yesterday of sort of venue VR, where you might have your own cardboard, you almost certainly will, but then you will go to a museum, to a gallery, to a smallish outfit in your room where there is a more sophisticated rig.
Clearly, you don't want to have a great experience. You can't have a great experience with the Google Cardboard at the museum side. Okay, there are much advanced kind of headsets or technologies available. That's much more effective, I think.
That feels to me, again, not coming with any sort of data points on this, but that feels like a stepping stone to me. That doesn't feel like the end game. Like that feels like while the sort of most interactive high-end stuff is out of reach of most, say, in this context of this panel, educational organizations en masse, that yes, everyone can have their own cardboard, but then you go somewhere to experience kind of the real interactive Vive experience, and that's great for now, but that can't possibly be the sort of the end game. That's kind of just a sort of a fix until it all kind of smooths itself out a bit.
It absolutely is. I mean, some of us, mentioning no names, are old enough to remember when it was the school computer. Not the school computer lab.
You have to book your session.
You have to book your session,
I think it's a question of like a government or society. Where is the kind of a support or funding where everybody can access those experiences? At the moment, cardboard, £10, everybody can buy. But obviously, everybody wants to have that kind of a real experience in the future.
But everybody's saying that cardboard is cheap, but you still got to have an expensive smartphone to make it work. So it's not that cheap. And it's really the combination. It's not just the headset, it's what actually makes that headset run as well. So whether it's a top-of-the-range computer or whether it's a top-of-the-range smartphone or it's a lower-range smartphone. It's all grist to the mill, as you said. I think it's different stages, and that different stages could be from people trying things out, or it could be just actually for they don't have access to anything else. We're looking at providing teaching into developing countries, for instance, and we're providing it at a slightly different level because that's what they need and that's what they can use right now.
I think HTC Vive, the price will go down in the future
Guess as good as mine.
for accessibility.
You heard it here first.
It's going
Yeah,
up.
I mean, I would say where I've seen the Vive being used now in schools is in computer labs.
Yeah.
You know, they have the space, right, and they are looking for kind of new technologies to help kids learn, and I think that's kind of where it's coming at.
Yeah.
I've also seen cardboard, I've seen gear, right, but I think it's a good point around access. It's
Yes,
you know, but
yeah.
again, even internet access and even PCs, that
yes.
still has not made its way to all developing countries at this point. So.
But
I think we
also-
all want to work towards that point, right? We all want to make kind of more universal access for all these kind of tools and technologies.
But also something that probably Chris can't say is that in actual fact, HTC Vive is more expensive because it's probably the best headset out there on the market, and it provides really great stuff for actually what you want to view. So
Well, the
that's-
headsets are available. Tim,
But
final
not as good.
thoughts on this one?
Well, I think the hardware's there. It's available. It is accessible. I think the difficulty the industry has got in monetizing training and education is that the whole life cycle hasn't been built out yet. We do steal from the gaming industry, and we use that as a basis for our training and education, but it's not a curriculum content-based system. You can use levels and that kind of stuff, but it's not really how teachers and trainers really work. And what we are really looking for is a content creation system that allows people that are expert trainers and content developers to actually build out these things and for it to be ported into this environment. And then after it's created in that environment, it has to interact with several systems. One is a point-of-sale system where people can go and access it and use it. For corporations, of course, they want their training department or their HR department to go and buy this stuff and then deliver it to certain known people in their organization and then get the results back and act on the results. So until we've nailed down, sort of all the other stuff, it's very expensive, actually. That's the expensive part, not how to project it into people's eyes and get them through the experience. It's the enormous upfront costs of creating it.
And the systems.
I think it's the same question from the previous session. Where is the return of investment? Obviously, the content is the king, but headset is about £1,000, but contents it could be, £500,000 if you really want to have a great experience. If £500,000, would you pay for that, and who will buy that? I think that's the real questions. And once it's developed and it's commercialization, where is the business model? Okay, is it a market? That is another question I think we need to think about.
Excellent. Questions from the audience before we thank the panel very much for their time. Question here.
I think
But
we've
no
used all the
microphone.
roaming cams. Maybe just
You probably don't have anything to say on this
He's
one
such a
anyway, Chris.
multitasker, look at it.
I mean, hearing what a lot of you saying about VR and education, it sounds a little bit like what was said about MOOCs, 4 years ago or so. And I mean, there were some successes there, but one of the reasons they sort of floundered was that, there was no mechanism to kind of accredit people for MOOCs, and there was no, doing a MOOC just did not have nearly the same cachet as, say, as going to university on a campus. So I just wonder how you address that. Does VR change that problem in any way?
Thanks.
Who'd like to have a crack at that
Right.
one? Marcus, did you want to?
Hi. I think that VR, the way we see it right now, is a way to enhance current learning experiences, not really to replace that correctly. I think that it's supposed to supplement classroom learning and make it more efficient or reduce training times and so on. And it can be very useful, for example, not just training in terms of technicals, but also psychological. So if you're on for example, if I had to study for oil and gas job the traditional way, the classroom, and then an emergency happened, I think all of the knowledge would just fly out my brain. But if you've had that mock experience in VR where it feels more realistic, you can better prepare for that. So I think it adds value in that way. I think without like a big network where everybody has a headset and we have proper multiplayer going on, I think before that stage, which might not be for another couple of years, we might not have like an environment which properly replaces a classroom, and because human interaction is very key for learning.
And as we were saying, the volume of VR content so far is only going to be sort of selected bits of the curriculum. I mean, it could get there very quickly. If you start filming every surgery, or if you start going to all the UNESCO sites, you can build that content very quickly.
Yeah, I think the whole point about content creation, it's a huge challenge, but it's also the opportunity that we have in front of us, because whoever creates that will be very happy. And I think to your point about MOOCs, what I've heard from the MOOCs themselves is a lot of it's engagement, right? People just sign up for their class, they might attend the first class, and that's it. They just never come back. So it's something like a single-digit conversion rate into kind of the students that actually fulfill that entire curriculum. Again, to Marcus's point, the level of interactivity and immersion you feel, keeps you engaged, and I think that's maybe the missing link that MOOCs are missing, that you could probably use in VR and potentially make that a much better experience.
And to use Tim's example, you actually know what people are doing. If it's interactive, you know they're engaging, and they're not just putting the headsets on or then putting them on the side.
You can see when they're nodding off, right? You can,
exactly. That quite scared me, that idea.
The head tilt. The head tilt. I think that's a good point. I mean, I suppose I sort of just conceptualize it in a different way. That I'm not thinking of it in terms of infrastructure and in the way that was asked. It's much more simplistic in my mind to a certain extent, which is if we're talking about young people, and it's stimulation and putting, the joy into education by bringing to life inaccessible, sometimes scary, geographically inaccessible stuff into the minds of children. And I know that's a bit sort of fluffy, but I think that any educator will tell you the biggest challenge is to engage people. And that's where this is an unbelievable, powerful force, I think.
Final thoughts to Marcus.
Yeah, just to follow on from your point, I think it's very, very important. And I think the closest thing in the education space, in the classroom space, which my startup works in, the closest research we can get is kind of the effect on field trips on learning, which we can draw similarities between a VR. And actually, psychologists have found that field trips generate interest in the subject regardless of prior exposure to a subject. So that could be very, very useful in motivation. There's evidence for that already. Field trips also improve students' self-confidence and other factors. So there's definitely research which has gone into that.
I could chat about this all afternoon, but I suspect if we're going to make it through, I've got to make it through till 6:30. We need to grab a coffee. So I'm afraid we're going to call the panel to a close at that. Gentlemen, thank you very much.
Thank you.
The panel,
Thank you.
ladies and gentlemen.
Thank you.